Hi, I'm Randy Ruda, Chief Executive Officer of the National Health Council. And at the National Health Council, our mission is to provide a united voice for 160 million people living with chronic diseases and disabilities and their family caregivers. We promote increased access to affordable, high-value, equitable, and sustainable health care. More than 150 national health-related organizations and businesses are National Health Council members. Today, more than 3 years since the start of the COVID-19 pandemic, the National Health Council remains dedicated to sharing the latest information with patients about their health and risk levels. To do so, we have invited a handful of leaders in public health and patient advocacy to discuss one of the most important and enduring questions: what factors increase risk for severe outcomes with the COVID-19 diagnosis? And further, how can we help reduce that risk? One of the most well-known risk factors we heard about with COVID-19 was age. So today, I'm pleased to be joined by our trusted messengers, experts and advocates who are particularly well equipped to share perspectives and help answer questions about aging as it relates to ongoing risk from COVID-19. And with this information, we encourage you to talk to your trusted healthcare provider for medical advice and to put your COVID plan in place. So, Sue, let me start with you. Talk to me about aging, the effect it has on the immune system. How do changes over time affect a person's ability to fight infections and disease?
Absolutely, and Randy, thank you so much, and the National Health Council for doing this. We all deeply care about aging, and so it's great to get the word out to everybody.
Super.
I would say in terms of aging and our immune systems, just like basically with our bodies itself, our immune system wears down with age. And what does that mean? That means that we're not as able to fight off infection, and also when we get vaccines, we don't keep immunity for as long a period of time. And that's part of the reason why the boosters are so important when it comes to COVID. But as a result, older adults really need to pay attention to risk factors related to COVID.
A little bit of additional information, I think older adults are also at risk because of conditions that they might have that impact their immune system and that weakens their immune system. It could be that they're on treatments for certain conditions like cancer or HIV or other things that can affect how they mount a response to actually the vaccines that they get and how that immunity lasts over time. So that's why being up to date on the COVID-19 vaccines is critically important for older adults.
One more thing I would add that I think is really important is, what do we mean when we say older adults, right? Because we tend to think of older adults as people 65 and older. But when it comes to COVID and risk factors, it's really people 50 and above, right? Ouch, sorry.
Exactly.
But that's what the recommendations are. And even if you're a healthy individual, what I said before about our immune systems declining as we age, you might think, oh, I'm tough, or I run, or I do this, or I do that. It just happens biologically to all of us across the board. So it's really important to pay attention, as ego-busting as it might be.
Well, it really calls us to action, doesn't it, on our own behalf and then in consultation with experts. Karen, let me turn to you and see what specific precautions should older individuals take when thinking about preventing infection and illness?
Well, the very first thing is they need to have a really good relationship with their health provider to make sure that they then can understand how a virus or why a vaccine is so important to them, because your health provider actually knows, of course, all of your health risk. So again, it's promoting information and getting information out to older adults so that they understand, so we can avoid some of these things. And obviously, prior even to preparing for vaccines to prevent something like a virus, just general health initiatives, staying healthy, exercising, eating right, all the things that they know that they need to be doing. And I know it's difficult in some communities.
Yeah, it's really important that you keep up with the other vaccines and other medical appointments that you might have let go to the side over the last couple of years here. So really important, get your flu shot, get your pneumonia shot if that applies to you.
Just, this risk of infection, this health-related complications, long COVID, I mean, that has already emerged, and I think we're still learning, but already emerged as something pretty scary and shocking.
And some of the recent research around long COVID shows that older adults are at high risk for long COVID, women, persons with certain chronic conditions, depression even, diabetes, obesity, and high blood pressure, which is very, very common. So, if you have long COVID or you think you have long COVID, really using these precautions is critically important. We don't know a lot about long COVID, and I think there are a lot of things are going to be found out over the next few years as more research is being done. So again, if you test positive, you have symptoms, immediately contact your doctor.
Which is such an important response, really,
Yes.
throughout just keeping yourself healthy, but then if there is anything. Karen, I know different communities absorbed information differently. Are you seeing the conversation about COVID-19, but then long COVID? Are people aware that that's even more of a reason that they should be diligent because that's, can be sustained and pretty difficult?
I'm not really hearing as much on their concern of long COVID because we're still trying to get people to stop being hesitant about getting the vaccine in the first place. You have to understand that in some communities of color, there's still some hesitancy and some concern and some fear about the vaccine itself, though we did tremendously well in getting people vaccinated early on. Now we're really working on trying to get people to get their boosters. And there's a lot of confusion in that I just got a booster, do I have to get another one?
Right.
I don't, and so we're trying, again, all these trusted leaders are trying to get information out to the community, particularly with older adults, to make them understand that when we say, at this age, or if you have these conditions, it's time for you to get another booster, that you do that.
Right.
One more thought about all of this, which is that, when we speak of age, just as we didn't all experience COVID the same way, we don't all age the same way. And structural racism and health disparities impact the way we age. And people who live in communities of color oftentimes experience chronic diseases at much earlier ages. So age of onset is really important to take into consideration, and that was something that was a lesson in COVID. It was an unfortunate lesson because the original recommendations were for people aged 75 and older, and the average age of onset for people of African American background was 71. And so they missed out on vaccines in that first wave. And we have to get on that now. It's like not waiting. We should have learned enough. Shame on us if we don't fix that right away.
One of the things that's been talked about is having a plan. And I think that's, I think that really makes sense. And Sue, you made the point of that plan. Clearly we're talking about COVID-19, but it probably includes a lot of other ways in which a person can maintain their health. And for older people, there might even be a greater sense of need or urgency. Let's talk about that issue of a plan. Is that something you're talking about at your organization and as you support?
Yeah,
people
absolutely.
that you support?
Yeah, I mean, I think there's a tendency a lot of times for people to feel like, oh, I'll just tough it out. So if you say, oh, I'm just going to ride this out, don't ride it out. Call your doctor and have that conversation.
I think older adults need to be as informed as they can be about their own health. And being advocates for their own health is truly important. A messenger that is close to my heart as a pharmacist are pharmacists, and they are available all across the country. So in terms of thinking about treatment, that is an individual that older adults can go to and ask the kind of questions about even staying up to date on what's happening with COVID. To your point, Sue, a little bit earlier, this virus is very tricky. We don't know a lot about it. It changes in ways that are unpredictable, so things can happen quickly. I don't want to scare anyone, but yeah, just understanding what's happening out there is vitally important, and what the new treatments might be, or if there's new vaccines coming down the pike. So talk to your pharmacist.
My 96-year-old mother was having a pain in her leg, and she went to her doctor, and the doctor said, well, it's just all a part of getting older. And I said, that's probably true. However, there's still a reason you have a pain in your leg.
Correct.
So she needs to let you know if you have arthritis, if you broke it, if you know, and there has to be a diagnosis. And those are the kinds of things we're encouraging older adults to do, is don't let just you're getting older and this is what happens to you. You have to, there's a reason, we live in a wonderful time when it could probably be addressed.
Sure.
You just have to make it then your priority.
Well, so, I think, Karen, you've talked about, the community that you are specifically serving. You probably have observations about other underserved communities. I mean, sometimes it's racial and ethnic, other times it's geographic. There could be lots of reasons, socioeconomic,
Zip code.
I mean, that's a zip code, big deal. Anything else that we should kind of, how should these populations, these individuals, should we pay special attention? What might we think about there?
Well, I mean, basically is we've got to start treating everybody equally. We need to understand that a healthy society is a productive society. The cost of not addressing health disparities certainly outweighs what we would input in keeping people healthy. And if people recognize that and stop thinking that when they talk about health equity, that's not taking away from you. That means that somebody is just trying to get to a point where they're as equally healthy as you.
What's your call to action then? Finding ourselves here. You've given great examples of, how we can empower and energize trusted messengers even further. You described resources that are that there's ready access to, both at the individual level all the way through the systems level. What's your call to action then for, the people that we're talking to here?
For our community, we're trying to make sure that young people know how to age. That these are things that they can start now. Eating healthy, exercising, getting their sleep, all the things that we know we tell older people to do, they can start now and hopefully avoid some of the things that enter as you age.
My message to older adults is don't be afraid to ask for help. I think many older adults tend to be stoic and, as you say, kind of ride out whatever issue they may be confronted with, but there's a lot of help out there, and I think more and more people have recognized, because of the pandemic, the needs of older adults. And one area of vital importance right now is social isolation and loneliness that the pandemic made worse. And there's so much wisdom that older adults can impart to younger generations too.
Yeah, you don't want to be like me.
Well, there's that. But also as role models.
I
want to be as healthy as grandmother or grandfather.
Well, matriarchs and patriarchs have that kind of influence.
They do.
So absolutely. So it's a two-way street.
Absolutely. That's intergenerational has always been, I think, a cornerstone of the senior community, recognizing the power of that, which is great.
Yeah, I just would say, we need to also lean into that, because I think there is this still avoidance of age, right, and seeming old. And younger people today actually think a lot of older people are pretty cool. And the problem, I think, is more with older generations, ourselves, if we're denying it, and so we really need to lean in, because we all need each other. It's not like we become a different species just because we turn 50 or 65, right? We're just an older version of our younger selves. And so I would just say that, we need each other. We need to get invested in each other and what we're doing. A lot of what we learned during the pandemic is we didn't know a lot about each other. And there's a lot to get to know. There's a lot of new friends to be made.
Absolutely. Well, let me just, as we go to close, let me just ask you to maybe make a plug for your organizations or the systems, because, as we're having this conversation, people will say, well, where can I go? And you made the point earlier about, we talk about trusted messengers, and then people go online and it's kind of a free-for-all. But there are organizations that can be accessed online or in other ways that are absolutely trustworthy and proactive and on the side of seniors. So I'll just kind of come down the line. Can you call out where those resources might be found?
Sure. I think first and foremost, all of us would agree cdc.gov, great resource. We have been working since the end of 2020 together with NCBA and Healthy Women on the COVID vaccine education and equity project, and you can go visit our website at vaccineproject.org. And also my organization, Alliance for Aging Research, we have a campaign called Our Best Shot. So if you go to agingresearch.org/ourbestshot, we have a lot of resources on COVID and a variety of other vaccines and lots of other information on age-related conditions.
That's fantastic to have those resources available. And I know these are learning resources. They're approved and improved and informed all the time.
All of what she said, because we have
Right.
links on our website to those sites. NCBA, which probably the majority of the people have never heard of, and I always say the reason you haven't heard of us is because you've never needed us.
Right.
So anyway, we are ncba-aging.org. We have all kinds of information and links to some of these other organizations where you can get information, but specifically we have toolkits and other information that help people if they want to set up something within their own community on how they address getting information out to their community, you know, what have you. So we have a lot of things. So it's ncbaaging.org.
Excellent.
Great, absolutely. The National Council on Aging has a pretty robust website, so that's ncoa.org. A couple of things I want to point out on our website is something called Benefits Checkup, which is a tool, a free tool that anyone can access to find out if they are eligible for federal, state, and local benefits. So things to help them pay for medications or to pay for food, like SNAP benefits, or to pay for electricity or housing assistance, those types of things so that older adults can use their money for other things. That,
Sure.
There's so much money that's left on the table every year that older adults should have access to. The other great resource is senior centers all across the country. There are about 10,000 senior centers in every community across the United States. They're a great trusted place for information about COVID, but also a great place to engage with other older adults. They often have intergenerational programs. Most of them serve a hot meal every day for older adults, and they do fun things. So definitely,
What's not to like about that
What's not to
network,
like?
right?
Exactly. Yes.
Well, this is great. I can't tell you how much I appreciate each of you and your career-long effort in this space. I look forward to continuing to work with you, and I encourage everyone who's been able to be a part of this conversation to make a plan, know that you can address COVID-19 and also the other issues that might affect your health, because you've got trusted messengers, an entire system of individuals and providers and others that are on your side. And together, we can address this issue and let it be a change agent, a catalyst for being better and healthier, and not something that we continue to struggle with year after year. So thank you, each of you, for your time today.
Thank you.
Thank you.
Thanks, Ray.